Hello again, Frontline. So we meet again. Hi, it's Val. I want to talk with you more about metabolic complications. We left off in the middle of the causes of metabolic complications, and the next potential cause is insulin resistance. So, just a really brief piece on insulin. Insulin moves sugar or glucose once it's digested to all of the cells of our body to produce energy or get stored for further use. So when someone has insulin resistance, the glucose isn't processed very well. So they eat food and it gets digested, but then the glucose doesn't get all the places where it needs to go. So one theory is that some people who develop lipodystrophy are already somewhat insulin resistant or prone to it. And insulin resistance is tested if somebody has a family history of diabetes, sometimes if there are symptoms that make a doctor suspect, but it's not a baseline test. And so if someone is testing positive for HIV and has developed lipodystrophy, they may not know that they're insulin resistant, or they may not sort of recognize a family history of that. And then some meds, HIV meds, can trigger more insulin resistance than there would be otherwise without the meds. There was a study that was done on protease inhibitors and insulin, and a study in San Francisco gave Crixivan to HIV-negative people. Their cholesterol levels didn't increase significantly, but they showed a decrease in insulin sensitivity, or an increase in insulin resistance, which is a marker of diabetes. And it's sort of an indication of the effect of these meds on insulin. So another potential cause is immune restoration. And so immune restoration isn't just in HIV. But what happens is if the viral load in someone's body is brought down very quickly, then the reigning theory is that's a really good thing, because then it gives the body a break from the damage that HIV has been doing. But sometimes the body still acts like it's under attack, and it stays in crisis mode even when the crisis has been averted. And so in these situations, the body sometimes stores fat quickly and in weird places, thinking it won't get another chance to get any fat, and so it's got to store this fat right here, right now. And so this has been seen with survivors of the Holocaust, childhood leukemia, and breast cancer, as well as HIV. So sometimes the sort of body reacting in crisis mode can change the way that it deals with fat, and that can lead to its own set of metabolic complications. But since there's not a central cause, since I just went through more than a half dozen different potential causes, there's not a central cure, there's not a central treatment. And we don't always know if the changes will keep going, stop, or reverse on their own. For example, sometimes lipodystrophy can be reversed, but not always. But here are some strategies that can work to treat the symptoms. So possible treatments: switch therapies, or go into switch studies, that is clinical research that looks at what happens when someone switches meds. Increase exercise or change diet, and I have 3 exclamation points there, because that should be a sort of a crucial first step for anybody going through this. Fat deposits can be removed by surgery or by liposuction, and some people have used implants to fill in their cheeks. These procedures can be risky. The results are usually only temporary, and also you really have to make an argument for your insurance company to cover it, that it's not just a sort of, that it's about quality of life rather than about, some sort of shallow appearance thing. And, they're looking to deny everything that they can. So the argument that you make, if you want to try to get this stuff covered, has to be really strong. Other possible treatments, human growth hormone is being studied, a very small study, 7 people in this study, and only 5 of them completed the study. So it's a very small study, but it showed that this human growth hormone, HGH, which favors the growth of muscle tissue over fat tissue, may have led to decreased fat accumulation. Again, it's a really tiny study. Another possible treatment is to use specific non-HIV related drugs to treat lab work changes. So in cases of decreased testosterone, have testosterone supplements. There are definitely drugs that can reduce the amount of cholesterol in the blood. There are some mixed reports on using anti-lipid, anti-fat drugs and statin inhibitors, and you should always, not just in this instance, but always be aware of drug interactions. And if a medical provider doesn't bring it up, be sure to ask, because it's possible that they don't bring it up because they've done their homework and they know it's not going to be a risk, but drug interaction studies, the data is accumulating all the time, so it's important to ask about that. And then the next thing here is to keep learning. There's a lot that we have to learn about metabolic changes. It's a field in progress. And one of the things that I always like to mention is that, we didn't know as much as we do about CD4 cells before HIV. And it was really HIV that led to a growth in understanding about immunology, and the growth of the field of immunology. And I sort of think that metabolism and all of the metabolic changes are going to be one of the next fields that has this sort of intense expansion of growth and learning. So there's a lot to keep on top of. We like to check the New Mexico fact sheets that I've pointed you to before, but if I haven't, AIDSinfonet.org. They're amazing, and they're in a lot of different languages, and they're low literacy, and they cover all sorts of stuff. We like to check PWA magazines and journals, so Beta, Positively Aware, and Pause. Those all do a good job of reporting on the news in friendly ways. And then here are some websites that you might be interested in going to. Thebody.com is fantastic. Aegis is HIV-related news. Nelson here has been a pioneer in this field, and he's got all sorts of interesting links and resources on his page, including a place where you can buy butt pads. So if your butt has lost its shape, you can actually buy things that will grow it back, but through the pants themselves. They're butt pads. It's really good. I think it's buttsforyou.com. And NATAP.org, the National AIDS Treatment Advocacy Project. I might be getting that wrong. But you should check it out. There's a lot to learn, and keep coming back. All right. Thanks so much. Talk to you next time.